Hi everyone, in our fundamental biomechanics series, we really need to dive deep to the real biomechanics. So that in this video, we are going to talk about the classification of joint to understand that. We are going to cover structural classification as well as the functional classification. We already done concave convex relationship, axis and planes, levers. So if you are new to this channel, check out that videos also. So the functional classification of the joint is based on the degree of movement they allow. So we have three main categories. First one synarthrosis, second one ampiarthrosis, third one diarthrosis. In synarthrosis, these are immovable joint. There is no movement. The baby's skull suture have some amount of movement, some amount of limited movement, so that the baby's head squeezed hard from the pelvis during birth. Eventually, while growing, the sutures gonna bind together, fuse together, so they don't allow any movement at all. So coming to the second category, it is ampiarthrosis. These joints allow limited movements. They are slightly movable. Example for ampiarthrosis, intervertebral disc in the spine. Coming to the third category, diarthrosis. These are freely movable joints. They have a wide range of motion and includes synovial joints like the shoulder or knee. We finished functional category. So now we are entering into structural category. In structural category, it further subdivided into three categories. Depends upon the structure it built, the joint cavity it has, what kind of material it used to adjoining two bones to form one joint. So by these kind of criteria, we divided into three main structural categories. First one, fibrous joint. Second one, cartilaginous joint. Third one, synovial joint. So from first one, the joints get together by the fibrous tissue. So in fibrous joint, these joints are connected by dense connective tissue, mostly collagen fibers. These are three types: sutures, syndesmosis and gumposis. For sutures, we found in the skull. These are immovable joints where bones are tightly joined by fibrous tissue. We already seen sutures in functional categories in arthrosis. Now we see it again in structural category. So sutures found in the skull. These are immovable joints where bones are tightly joined by fibrous tissue. Next, syndesmosis. These have more movements than sutures and are connected by ligaments. Example for syndesmosis, distal tibiofibular joint. So third fibrous category will be gomposis. These are peg and socket joints, like how teeth fit into their socket held by the periodontal ligament. So we finished fibrous category. So now we are entering into cartilaginous joint. In cartilaginous joint, generally in our body we have three cartilage. First one, hyaline cartilage. Second one, fibrous cartilage. Third one, elastic cartilage. So coming to the joint classification, we only have these two, hyaline cartilage and fibrous cartilage. So first one, primary cartilaginous joint. It's totally about the hyaline cartilage. So we have temporary primary cartilaginous joint, that is our epiphyseal plate. While growing, the epiphyseal plate gonna fuse, so it is temporary. And we also have permanent hyaline cartilaginous joint. It is our costal cartilage joint. So it is permanent from the birth to till that it is permanently fixed in our body. From movement wise, our costal cartilage allow a small limited movement while breathing. So from the functional categories, it is ampiarthrosis. Secondary cartilaginous joint, it is symphysis. The most familiar symphysis joint is pubic symphysis. These are the joint by fibrocartilage allowing limited movement, example including the pubic symphysis and the intervertebral discs. So the final structural joint classification will be the synovial joint. These are the most movable joints and have a joint cavity filled with synovial fluid. So the synovial joint subdivides into 6 major joint types: pivot joint, ball and socket joint, condylar joint, plane joint, saddle joint, hinge joint. Example for pivot joint, atlantoaxial joint, ball and socket joint, example shoulder and hip joint, plane joint, example intertarsal joint in our foot, saddle joint, example sternoclavicular joint, hinge joint, example elbow joint, the articulation between ulnar and humerus. So these are the synovial joint. So from the functional category, all synovial joint allow a wide range of motion, so it is diarthrosis. So this is the overall structural and functional classification of joint. The last final question part will be, what is the example for condylar joint in our body? So put your answers on comment section. If you really want to learn from the fundamental of biomechanics to the clinical practice, don't forget to subscribe my channel Learn with Ian for more videos. Thank you.